And respiratory acidosis, well, it would be somewhere on this line for acute respiratory acidosis. And if it was there, metabolic station, or essentially you would raise your bicarb to get towards pH 7.4. So you know what? I'm actually in the opposite direction. It's not going to be an overdose of opiates. So most of us went with COPD with metabolic compensation. COPD would cause the respiratory acidosis because you can't blow out the CO2. And metabolic compensation, it would increase the so case, because in both B and C, the point would have been somewhere in this area. You know, for A, the point would have been somewhere in this area. And I'm exactly where intoxication with severe coupling is going to cause us to have both metabolic and respiratory acidoses. So it's going to be a mixed acidosis. I took this one first because when I'm going to explain to you the diagram, you'll be crystal clear, I hope, about all the wedges on that diagram. I took this one first because as we were starting this evening, I was chatting with a few of us, and mixed disorders seem to be an issue. So that's why I was mixing the things. But here it's severe uncoupling of electron transport chain. Someone who took aspirin may be to try and attempt suicide, for instance. Now, chronic loop diuretics, I'm going to go back to my green pen because when you have loop diuretics, I know 4 of us wanted this. Loop diuretics, they make you waste a lot of fluid, and volume plus sodium losses is going to cause which hormone? Metabolic alkalosis, not acidosis. What happens? You lose volume and sodium. And it'll work on principal cell of the cortical collecting ducts. That's right, Al. That's going to cause a secondary increase in aldosterone. And that secondary increase in aldosterone is going to promote metabolic alkalosis. And if I'm chronically on that drug, well, the metabolic alkalosis is obviously going to be associated with some compensation. Metabolic alkalosis is going to be right here, and with compensation is going to be in this wedge. So my answer E would have been up in that portion of the diagram. Well, it was an annoying question because, look, after all, only a couple of us went to severe aspirin intoxication. So I think for right now, how about we use that diagram and that question and start talking about acid base and at least work out the diagram. Does it sound fair?